Hello student, today we see the external feature of the brainstem. Okay, first what is the brainstem? The brainstem, it is a stalk-like part of the brain which connect the spinal cord with the forebrain. So which are the parts of the brainstem we have? So in the brainstem, we have three parts from below upward. It is medulla oblongata, pons and midbrain. Okay, now in here we can see from below upward, this part is a medulla, this is a pons, and this is a midbrain. Where the brainstem is located? So brainstem, it is located in the posterior cranial fossa. When we open the skull, inside the skull, this part is known as a cranial cavity. Okay, so this part is known as the anterior cranial cavity. This is the middle cranial cavity, and this part is a posterior cranial cavity, in which you can see this foramen. This is the foramen magnum, through which at exactly the margin of the foramen magnum, the medulla is continuous as a spinal cord. So this is the part where the brainstem is located, and this is the anterior sloping surface of the basi-occiput. It is known as the clivus. So the anterior surface of the brainstem is in relation with this clivus. Now, when we see from the side, right? So this is the medulla oblongata, this is the pons, and this is the midbrain. This posterior part, this is known as a cerebellum. The posterior surface of the pons and the medulla separated from the cerebellum by this cavity. That cavity is known as a fourth ventricle. Okay. Now from the ventral surface, when we see the brainstem, it is a look like this. There is also some of the elevations. We see the detail of the each part separately. Okay. Now this is the medulla oblongata. Above it, this part is the pons, and above it, this is known as midbrain. Okay, when we see in the real figure, okay, this is a look like a spinal cord. Yes, it is a spinal cord, continues a medulla, and which is a here it is a pons, and this smaller part it is a midbrain. Okay, which are the constitute of the brainstem? You've seen in the spinal cord there is a gray matter and the white matter. The white matter, it is a tracks. So same track, it is a continue in the brainstem. It is a, whether it is a ascending track or the descending track. What happened to the gray matter? What you see in the spinal cord, the gray matter, it is in the center and it is aggregated mass, right? It which from the edge shapes gray matter in the center, which is surrounded by the white matter in the spinal cord. It is not in the brainstem. In the brainstem, there we see the small aggregation of the gray matter, which is we known as nuclei. Okay, so here main constitute of the brainstem is one, it is a tracks, ascending track, descending tracks, and also some other the connecting tracks with the cerebellum and the nuclei. In addition to these two, there is there is a well defined system of the track and then nuclei, which is a diffusely arranged in the whole of the brainstem in all three part, that is we known as reticular formation. Okay, now the central canal of the spinal cord, it is also continue upward in the medulla in the only in the lower part, but then upward it is a continue with the fourth ventricle. Let's see here. Okay, now this is the spinal cord, right? So this is the central canal of the spinal cord, continue upward only in the lower part of the medulla. Then it is a expand and it is a continue in the fourth ventricle. Now, which are the functions of the brainstem? Now, first we have seen which give the passage to the various ascending and the descending tracts. Okay. Then it is also contain the important autonomic reflex center, which is known as a vital center. So, which are the vital center present in the brainstem? It is a vital center for the respiration, which control the respiration. Then vital center for the heart rate, which is known as is a cardiovascular. Then also for the vital center for the blood pressure. Okay, then it is also contain the reticular activating system. What it is, we have seen the reticular formation present in the brainstem, which is important for the consciousness. Then another is contain the important nuclei of the last 10 cranial nerves. So the cranial nerve number from 3 to 12, Then nuclei is present in the brainstem in a different part, in the midbrain, in the pons, and the medulla. We see in the detail in which part which nuclei is present. But except the first two, cranial nerve number 3 to 12, then nuclei is present in the brainstem. Okay, the other part, each development of the each part we see separately. Then we start with the first medulla oblongata. From where to where it is extended? So medulla oblongata, it is extended from foramen magnum up to the lower border of the pons. Now here, this is the medulla oblongata. I shown you a foramen magnum. So exactly at a margin of the foramen magnum, the spinal cord is become the medulla oblongata. And this is the pons, and this is the lower border of the pons. So from foramen magnum up to the pons, this part is we known as medulla oblongata. Okay. Then another name of the medulla is also known as a bulb. So the nerve which is related with the medulla oblongata, if it is a damage, that is a whatever the paralysis is occurred, it is also be known as a bulbar palsy. Okay. The important vital center which is the present in the medulla, it is a cardiac center which is for the heart rate, vasomotor center which is for the blood pressure, and the respiratory center. The medulla provide the attachment to the last four cranial nerve, which is a cranial nerve number 9, 10, 11, and the 12. So these four cranial nerve attached to medulla. Okay. The central canal, as we have seen, it is extended in the medulla in the only the lower part. Okay. Now we divide the medulla into a two part. The lower part, it is a closed part, and upper part, it is a open. Now we see the external feature of the medulla oblongata. So first, now here, this is as you have seen in the spinal cord, right? In anteriorly, spinal cord has a anterior median fissure. The same anterior median fissure is continue in the medulla oblongata. Okay, and it is extended up to the lower border of the pons. So their upper end, where this anterior median fissure is end, here there is a depression, and this depression is known as foramen cecum. So it up only upper, it is extended only up to the lower border of the pons. In below here we can see this anterior median fissure, it is a interrupted. Why there is an interruption? Because here there is a crossing of the corticospinal tract. Same on a posterior also, this is the posterior median sulcus. Same, it is the upper continuation of the posterior median sulcus of spinal cord. It is only present up to the lower part. Now here then you can see it is a diverge, in which ultimately form the boundary of the lower some triangular area of the floor of the fourth ventricle. Okay. Then this is the anterior median fissure. On lateral to it, this is known as a anterolateral sulcus. So where the anterolateral sulcus is present? Now, this elevated part exactly lateral to the anterior median fissure, this is known as a pyramid. This is a pyramid. So lateral to the pyramid, this is the anterolateral sulcus. Same here also here. This is the posterior median. Okay. Now, then if we go from medial to lateral, the most medial is anterior median fissure, then a pyramid, and then this is a anterolateral sulcus. Then these elevated rounded part, this part is known as a olive. And lateral to the olive, this is known as posterolateral sulcus, which is between the olive and the inferior cerebellar peduncle. What is a cerebellar peduncle? With cerebellar peduncle, it is a connection between the brainstem and the cerebellum. Now, connection between the medulla and the cerebellum, it is the inferior cerebellar peduncle. Connection between the pons and the cerebellum, it is a middle cerebellar peduncle. And connection between the midbrain and the cerebellum, it is a superior cerebellar peduncle. So here, how many part we have on the this ventral surface? If we go from middle, exactly, this is the anterior median fissure, upper end, Foramen cecum below interrupted by the corticospinal tract. Lateral to it on each side of the anterior median fissure. This is the elevation which is known as a pyramid. Now, why this elevation? Here there is a special tract is passed that is known as a corticospinal tract, also be known as pyramidal tract. Lateral to it, it is a anterolateral sulcus on both sides. More lateral to it, this is the olive, and more lateral to it, here is the inferior cerebellar peduncle. Okay. Now where it is a why this is the olive, deep to the olive, it is a inferior olivary nucleus. Now, where you can see the attachment of the cranial nerve. First we start. Now this is anterolateral sulcus. So between the pyramid and the olive, this is a rootlets of the 12th cranial nerve, which is a hypoglossal nerve. Then between the olive and inferior cerebellar peduncle from the posterolateral sulcus, here the attachment of the three cranial nerves, if we go from above downward, ninth, 10th and the 11th. Ninth is glossopharyngeal, 10th is the vagus, and this is the cranial part of the accessory nerve. The accessory nerve is a two part, cranial part and the spinal part. The cranial part is attached to the medulla. So this is the attachment of the cranial nerves. Between the pyramid and the olive, 12th, between the olive and the inferior cerebellar peduncle, it is an above downward, 9th, 10th and 11th. Glossopharyngeal, vagus, and this is the cranial part of the accessory nerve. This is the attachment of the last full cranial nerve on the medulla. So this is the how the medulla is seen from the front or anterior aspect. Now this is the from the posterior aspect of the medulla. So in the posterior part we have the two again. This is the upper part. This upper part, it is the open part, and this is the closed part. Now in the closed part, exactly midline, we have the posterior median sulcus. Okay. Now on each side of the posterior median sulcus, you have again this is the 1 and 2 elevation on a both side, 2 elevation. This 2 elevation is known as fasciculus gracilis and fasciculus cuneatus. Okay. And more lateral to it, it is a this is the inferior cerebellar peduncle. So if we go from medial to lateral, first exit in the midline, posterior median sulcus, next is fasciculus gracilis, next is fasciculus cuneatus, and next is this is the inferior cerebellar peduncle. If okay, if we go more laterally, inferior cerebellar peduncle, then it is a posterolateral sulcus, olive, anterolateral sulcus, pyramid, and anterior median fissure. This we go from posterior to anterior by complete circle. Okay. Now deep to this fasciculus gracilis and cuneatus, there is again same fasciculus nucleus and cuneate nucleus. It is a nuclei for the tracts. Now this is the feature of the lower closed part. Upper open part in a medulla, the detail we will see with the floor of the fourth ventricle. Right now we are not going the detail of the this fourth upper open part of the medulla.